you go ahead and start?
Hey, good afternoon, everyone. So as you know, we had quite the ongoing smoke event. We had smoke transported in northerly winds from wildfires that are located over eastern Manitoba and western Ontario. That event is beginning to wane a little bit, but hot on its heels, we have another cold front that's going to push south on Saturday, and that's going to bring another shot of smoke into the state, starting tomorrow afternoon. And that smoke will linger over the area through Sunday into Monday and Tuesday as well. So um, this is quite the unprecedented smoke event for the area. Usually these events are, maybe 1 or 2 days. This is going to end up being a 5 to 6 day event for the area. As far as impacts, we expect similar smoke levels to what we've seen over the past couple days. We've had smoke concentrations in the code red, which is unhealthy, and even code purple, unhealthy. So we've issued some updated forecasts for over the weekend. So we expect a wide swath of up to very unhealthy, stretching from the Lake of the Woods, north central Minnesota, down into the Twin Cities. So the worst of it we expect will be Saturday night and Sunday, stretching into early Monday. But overall, the event will last even longer than that, as the smoke circulates around high pressure into the day Tuesday. Mike, did you want me to go into health messaging, or we could pass that on to?
I'm sorry. Yeah, I'm sorry if you just the more general stuff. Obviously, that
yeah.
If you want to just talk about kind of general precautions that people should be taking, and then if there's any other tips or things we want to suggest for the general public regarding the air quality, and then if there's specific questions related to health, I would like to direct those to Jesse Schmuel.
Yeah, sure. I could speak to a general sense. Since the code red and code purple area covers such a wide area, we could say that, and because the event is lasting such a long time, generally everyone should limit their time outdoors. If you got to go run to the store, run to the doctor, that's fine. But you wouldn't want to, spend hours outdoors if you can help it. Also, you wouldn't want to say go for that 10-mile run. That would definitely not be a good idea. So when the concentrations of particulate reach these levels, even healthy individuals, start feeling effects.
Okay. Anything else, Nick, or are you ready for questions?
Yeah, I'm ready for questions, or if health
Jesse,
folks want to follow up. Yeah, sorry.
Jesse, did you have anything Jesse Schmuel from Minnesota Department of Health, did you have anything? And then I'll go to questions. I do see somebody with a hand up. Yeah. Go ahead, Jesse, if you have anything to add. Otherwise, I'll take questions.
I'm happy to wait for questions.
Okay, great. I think the first one, Bill Werner, why don't you go ahead with your question?
Yeah, thank you. I appreciate it. Do you have any feel? I know that periodically and over the last few days, there have been air quality levels that have even reached hazardous in some parts of Minnesota. I think north central, right, Brainerd, St. Cloud, and that area. Do you anticipate any of that to that level of severity occurring over the weekend or even into early part of next week? And if so, when we get to hazardous, I mean, are there additional things that people need to be concerned about in that particular case?
I could start. So on a 24-hour basis, which is what the health standards are based on, we haven't reached the hazardous level. You're right. At the 1 hourly or the very short term, it has peaked in that hazardous. Okay. But overall, I think on the 24-hour basis, which the health standards are based on, we've peaked in the very unhealthy, or the red, or purple. Sorry, the purple.
Are there certain, if I may just do a quick follow-up, are there certain areas of Minnesota that are going to be where this very unhealthy condition is going to perhaps persists longer. Certain areas of Minnesota where folks should really be aware and particularly watch at certain sections of the state or regions of the state.
Right. The areas of most concern would be kind of north central part of the state. So I'm sorry. Got the air quality phone going on. Apologize. So the area of most concern would be stretching from roughly Leech Lake, Red Lake area down south to Brainerd and St. Cloud, even touching the Twin Cities Metro, and then back on north, roughly the I-35 corridor up to International Falls. That would be the area of most concern of seeing the very unhealthy concentrations.
Okay, so up I-35, you're saying all the way, and then
west.
Then west over. Is it going to include the Duluth area at all, or the North Shore? Any part of the North Shore?
We expect Duluth and the North Shore to be on the orange to red. They're kind of on the gradient between the orange and red. We don't expect sustained long time periods in the very unhealthy.
Okay. The reason I was just asking is because obviously. Would you mind maybe if you want to elaborate at all on health precautions? That would be, I think, very helpful. Thank you.
Go ahead, Jesse.
Sure, thanks. So what we're what we're seeing is that like Nick said, for these, when we're in the orange and the red, the unhealthy for sensitive groups for the orange, and those sensitive groups would include people with heart or lung conditions, older adult, children, and teenagers, and so for those people, especially folks with asthma, we would recommend that you follow your asthma action plan and keep your relief medications nearby. These levels of particulates can be very irritating to the respiratory system, and they can also have impacts for people with heart disease as well. So symptoms like palpitations of the heart, shortness of breath, or unusual fatigue may indicate that people with underlying heart disease are having a problem related to this exposure.
Well, I'm sorry. Please, I apologize.
Sure. And so our real advice is to monitor your symptoms and contact your healthcare provider if your symptoms are starting to worsen. In these, as we move though, as Nick stated, as we're moving into these unhealthy and very unhealthy levels of particulate, this really impacts everyone, even folks that do not have asthma or heart disease or other conditions that might make them more sensitive to particulate pollution in general. And so in these levels, these really, very high unprecedented levels, the health recommendation for everyone is really to reduce that level of reduce your time outside, take breaks, certainly limit heavy exertion, and consider, especially when you get into that purple, the health recommendation is to consider moving your activities indoors, rescheduling to a time when air quality is better.
Will N95 masks help? A few of us have those around, obviously, for other reasons, but will that help if a person has to be outside and they're experiencing irritation?
Sure. We've been anticipating a lot of questions around masks. And you're right, we are all a lot more comfortable or familiar with masks than we were 2 years ago. So N95 masks, as you know, they really are most protective when they are properly fit tested. And many of the N95s or KN95s that folks have been able to buy and use as a precaution against COVID exposure do provide they aren't typically properly fit tested, and so they don't necessarily an N95, the mask in and of itself doesn't provide the robust protection that it does when it is properly fit tested. And so because we know that the general public really generally does not have access to those proper fit testing from a professional that they would in a healthcare or other setting, we're not recommending broadly. We wouldn't recommend that as a broad mitigation measure. What we do know is that from the science is that cloth masks or the disposable masks on their own really do not provide robust protection against especially the finer particulates once you're below that PM2.5 micrograms scale. And so while we are encouraging folks to take the precautions of monitoring their symptoms, staying indoors when they can, limiting exertion, we don't really want to provide a false sense of security that people should, do those outdoor exertion activities at these very high levels with a mask that may not actually provide them adequate protection when it's not properly fit tested, or a cloth mask that wouldn't be expected to do that. I hope that answered your question.
It most certainly did. Is someone else have their hand raised? In which case, I did have one quick follow-up, but otherwise I'll
go ahead, Bill, and then I'll go to Maria Paul.
Okay, I apologize if I'm okay. I'm just wondering, Ms. Schmuel, if you are seeing any reports from hospitals, various other healthcare facilities of increased cases of people coming in with respiratory distress.
Go ahead, Jesse. Thank you. Yeah, so I'm not a physician, and I have not been personally in touch with physicians. So I can't speak to that specifically for this event. Certainly, we when levels are this high, we do expect that emergency rooms may be seeing increased visits, and that providers may be getting a greater number of calls from their patients that they serve. But I don't have any specific data or information, anecdotes or otherwise, from physicians at this point. I'm sure that we can provide that early in the next week as we learn more.
Oh, yeah, I was just wondering if that's something the health department would monitor. I appreciate that if you do that, if you would keep us apprised. Thank you very much.
Thank you, Bill. Maria Paul, go ahead with your question.
Hi, thank you so much. I have more of a big picture question. I was wondering how much of this could be attributed to climate change, and, with this really dire wildfire season that we're seeing, and that will possibly, be how the next wildfire seasons go. Is there any concern that these smoke conditions may present themselves in future years?
Yeah, Nick or Daniel Dix, do you want to go ahead and respond to that, or do you have a response?
I was going to say I might hand that to Daniel.
Yep, go ahead, Daniel. Daniel Dix is
yeah.
the air quality supervisor for the air quality forecasting team.
Yeah, hi. Yeah, that is definitely a thing that we've had on our mind for several years, and we have seen an increase, especially in the last 5 or 6 years of wildfires. We have looked out west in the United States and in the Canadian provinces of what's been taking place, following along other scientists' work, and the DNR Climate Office is also in the same realm that they are explaining that there is a climate change taking place. We are seeing warmer conditions, drier conditions in areas. So yeah, we expect that this will continue. Will it be this intense every year? That's hard to say, because there are some years, such as last year, where it wasn't as intense because the wildfires were more concentrated out west versus in Canada. This year just happens to be Canada and probably out west as well. But we are keeping an eye on that. We do expect that there'll be scenarios like this in the future, given what's taking place.
Oh, just as a follow-up, if I may, like if you're expecting these conditions to continue, is there any plan in place for how to adapt to them, or not at all yet?
As far as planning and dealing with it, one of the big things is improving our already really good forecasting and alerting process that we have here at MPCA, and working with EPA and the surrounding states, and also working with Department of Health. What are some improved or expanded, updated ways that we can help the citizens of Minnesota to deal with this situation? It's also going to be other mitigation factors we try, but much of the issue that we deal with is outside of our hands, because it is from Canada. It's meteorological conditions that do impact that. So we always have to be prepared for what is brought to Minnesota from those fires to the north and the northwest.
Oh, I just have one more, sorry.
Yeah, go ahead.
Sure.
So kind of, I think it's hard to understand kind of like how bad these effects can be for someone's health. So is there a way that to kind of phrase or explain what inhaling the smoke is like? I was reading some reports about it being kind of like inhaling a pack of cigarettes. Is there some likening or similarity to this that could help people understand why it would be really bad to be outdoors with these conditions?
What is that a question that Jesse should take?
I think so, yes. Thank you.
Jesse Schmull from the Department of Health.
Sure. Yeah, I am not an expert in what the wildfire smoke mix, what the components of that might be, different from our normal particulate mix that we get. And no, I don't. I would like to know an analogy like that, but I don't have one handy. Sorry.
I can add in that we do know that the smoke is a lot of chemical reactions take place, especially as it travels this long distance. And you will get hundreds, if not near 1,000 different small components of different pollutants within wildfire smoke. So it's loaded with volatile organic compounds, black carbon, PM, SO2. It's a long list of pollutants and hazardous pollutants that are within the smoke. And as it takes that chemical transformation, as it travels, that's why sometimes you will smell it, and it doesn't quite smell like your normal campfire nearby, but more of a plastic smell, and that's that chemical transition that takes place. So, and there's a ton of bad pollutants, so to speak, in that, and I think that's something that a lot of research is being done on those impacts on people. We're seeing that in British Columbia now on some of the local residents, and how bad it truly is, because they're right at the heart of the smoke and the high concentrations of the various pollutants.
Did you have additional questions, Maria?
No, thank you so much. This was super helpful.
Are there other questions out there? You can put them in the chat if you do have questions. Otherwise, if someone else has a question, please feel free to jump in or raise your hand. And again, you can certainly type a question if you don't have one. If you're not able to speak or have a microphone handy, please type your question. And I guess while we're waiting again, Nick, I guess if you can just explain some of the precautions or things that folks can do out there when there are conditions like this, can you just kind of review those for the people that have joined us here?
Yeah, we have some general precautions that apply to any air quality situation, such as carpooling, which no one's going to work tomorrow, or not many people going to work tomorrow, so that may be more for Monday and Tuesday. But you can carpool, reduce your vehicle trips, or delay it. Maybe you don't have to go to the store or make that trip until maybe you could delay it till after the smoke episode. Avoid burning wood. Mowing your lawn. That's outdoor exertion right there, is mowing your lawn. So you may not want to do that anyways. And generally refueling your car. That's about it.
And then I do have two questions that have come in from WDO TV. Do you have any recommendations for folks planning on camping this weekend as the first one? And then I do have a second question.
I don't know if that's more of an MDH question. I mean, you're outside and you're in the thick of it. You're gonna be exposed, and that's the risk you're gonna have to be willing to take. I would probably not do it if I had a kid who was asthmatic, or if I was asthmatic.
Jesse, do you have, or Jim, maybe Jesse Schmuel or Jim Kelly from Minnesota Department of Health, do you have a response?
This is Jim Kelly with the Minnesota Department of Health. Just anecdotally, my daughter coincidentally was supposed to go on a camping trip this weekend, and they ended up canceling it just because they were planning on hiking and being outdoors the entire time, and it was going to be in the area that is likely to see one of the potentially purple levels of air quality alert. So I think they came to that conclusion on their own, and I think it was a wise one, even for young people, to avoid a lot of exertion in this environment. So I think we'd give people the same advice, that they really need to think carefully if they really don't have any indoor spaces to go and the air quality gets particularly bad. It's not a good situation.
Thank you. And then the other question I have here is, do we anticipate the alert will extend beyond Tuesday? I don't know if you have want to anticipate beyond Tuesday, Nick or Daniel.
Yeah. So at that point, winds will be turning out of the south, which should start kicking the smoke back north into Canada. Of course, it's a lot of times it's a little uncertain exactly how quickly things will clean out. So we're going to be watching things closely on Tuesday to see, if we need to extend it, or alternatively, if it's looking better than we expected, if it's, below orange statewide, we could certainly cancel the alert early.
Okay. I don't see any other questions right now, but I want to give people a chance if there are additional questions that people have. Are there other questions? Oh, I think Jesse, did you want to add something? Jesse Schmuel from the Department of Health?
Yeah, thanks. I just, if there are other questions, happy to field those, but I did just want to take a minute. We are, given that we are also in the middle of a respiratory pandemic, and just note that, there are some symptoms of COVID and breathing wildfire smoke that may be the same, like a cough or a sore throat. And so we would, from a health perspective, want people to pay attention and consult with their healthcare provider. And that, of course, if they're having more severe symptoms like difficulty breathing or chest pain, that they should seek immediate care and call 911 or go to the nearest emergency facility. But we also know that there are other COVID symptoms that are very unlikely to be related to smoke exposure, like fever, chills, muscle body aches, vomiting, diarrhea, loss of taste or smell. So if you do have these symptoms, we don't want them to be chalked up to the smoke event, and you should contact your healthcare provider and get a COVID test, because while there is some overlap between symptoms that people may be feeling between COVID and the smoke, they're also they're not all the same. So I just wanted to add that from the health department's perspective.
Thank you, Jesse. Are there other questions that folks have? Please, you can go ahead and state your question, or again, type your question if there are additional or follow-up questions. I guess the other thing I would say is, I don't know if Nick or Daniel or Jesse or Jim, if there's anything else you'd like to add at this point, but I'll just keep it open here if we have a few more questions.
I guess I can say for the NPCA part is be vigilant, pay attention to the latest forecast, current conditions on our website. You can download the Minnesota Air app, sign up for EnviroFlash, email notifications, because things can change. We anticipate the smoke to roll in from Canada tomorrow into the weekend, Monday. However, if things do change, we will immediately update our forecast and the alert status. So it's always good, just like winter storms or anything else, things can change. But from what we see right now, we're pretty confident that we will have a significant smoke intrusion once again. So keep doing on the latest forecast and the alerts.
Thank you, Daniel. Nick or Jesse, did you have anything else to add?
No, Daniel covered that pretty well. Yeah.
And I would just, the one thing I would like to add, again, this is Mike Rafferty with the Pollution Control Agency Communications Office. If there is a change in the conditions, we do have the meteorologists and the agency and the health department. We are monitoring this throughout the weekend. So if there are changes that need to be made, we will reflect that throughout the weekend if things change dramatically or shift for the better. But as it stands right now, we do anticipate this going through Tuesday. So again, we'll be monitoring that, and people can continue to look at their quality website, or as Daniel mentioned, download that app, and you can check on the conditions through our website as well. Any other questions? I'll just pause in case we have more questions. We're scheduled to go to 4:30, but certainly if we have questions, we can continue beyond that. But I also want to respect people's time here as well. I appreciate everyone who has joined our media briefing. And again, I'll just pause for a minute here in case there's any additional questions, or if you need to type them in the chat. Okay, I think we'll go ahead and end this. Again, if you do have questions, you can contact Nick Whitcraft through the phone number that was listed on the news release, and we will coordinate any additional media response or follow-up. Again, I appreciate everybody attending, and also for our Pollution Control Agency staff and Department of Health staff for being available for the questions. And I wish everybody a good weekend, and again, be safe and stay safe, and take heed of the advice. Thank you. And I'm going to end it now unless there are any additional questions. Okay. Thank you, everyone. Have a good weekend.
Bye.
Thank you.
Bye.
Bye.